Okay, Pam. So we're going to move on to the treatment stage. So the goals of treatment is to be to reduce the pain in your glutes and to reduce your piriformis syndrome symptoms that you've been having. The type of treatment we're going to be doing is rehabilitation treatment, and that will also reduce the pain in your glutes and reduce your sciatic symptoms. The response that I'm going to be looking for is that your pain in your glutes is reduced, and also that the symptoms for your piriformis syndrome is also reduced. I'm going to have you come in once a week for a 1-hour treatment for the next 6 weeks, and we're going to be getting you to do a reassessment in 3 weeks, just so we can see if the treatment has been helping, or if it hasn't been helping, we can modify the treatment and try a different route. We're going to be using hydrotherapy on your gluteal region and on your hamstrings, and then while I do that, I'm going to be treating a bit of your low back just to relieve some pressure. And for exercises, I'm going to be having you do the figure 4 stretch for your piriformis. We're going to be doing that 3 times a day, holding it for 30 seconds on both sides. Do you have any questions before we begin treatment? No. And do I have your consent? Yes. Perfect. So what we're going to do now, I'm just going to tell you a bit what we're going to do before I get you on to the table. So first what I'm going to be doing is I'm just going to have you lie on the table. I'm going to be applying it to your back, your gluteal region, and your hamstring. And the purpose of the treatment is to help reduce that pain that you've been feeling in your gluteal region, and hopefully to reduce the symptoms you've been feeling with piriformis syndrome. The risk of treating these areas is that I might reproduce your piriformis syndrome symptoms. So please let me know if you feel any kind of symptoms down in that area. The benefits of me treating this area is hopefully to finally reduce the pain in your butt and to reduce the symptoms that you've been feeling. Some complications that we might deal with while treating is I might be using certain techniques that might trigger your symptoms. So if that happens, let me know. We'll modify, we'll change some techniques so that that doesn't happen again. At any moment in time, if anything becomes too intolerable, we can stop and try a different way of treating. I will be checking in on your comfort level. If you feel anything that's over a 7 on pain scale, let me know, and I'll stop and we'll try something else. And do you have any questions before we begin? And do I have your consent?
Yes.
Perfect. So you can just get in between the sheets. I'm going to leave the room, wash my hands, and be right back.